Hi, my name is Dr. David Horovitz. I'm a urologist in Bakersfield, California, and my office is located at 3941 San Dimas Street, Suite 103A. Today I'd like to talk to you a bit about prostate cancer. Prostate cancer is a very common cancer that we see in men. It's usually diagnosed either because somebody's PSA is increased, and that's a blood test that is done to screen for prostate cancer, or because an abnormality is located when your doctor feels your prostate on your rectal exam. For the most part, prostate cancer does not have any symptoms, so the fact that you're peeing well or you don't have any significant symptoms in that area doesn't necessarily mean that you have prostate cancer. In fact, once patients have symptoms, that's usually a sign of extremely advanced disease, and so it's rare for people to actually present with symptoms. Usually, if you have an abnormality on your PSA test or on your rectal exam, you'll be referred to a urologist such as myself, and we can do further studies in order to determine whether or not you have cancer. One of the most common things that we would do is a ultrasound guided prostate biopsy, which I do here in the office. There are other ways that we can look for prostate cancer as well, such as MRI or other fancy urine or blood tests, but I would say that the prostate biopsy is still the most common method. Once we determine if you do have prostate cancer, we do a full workup to stage you in order to make sure that the prostate cancer is localized to the prostate and hasn't spread. And after we do that, we generally will talk to you about your treatment options. Sometimes we don't need to do anything at all, depending on the type of prostate cancer. We can observe it, we can do what's called active surveillance, or just follow it very closely and make sure it doesn't progress. And then other times we'll treat it. Treatment in general is in the form of surgery to remove the entire prostate or radiation. Of course, there are a few other methods as well, but those are not as mainstream. Taking your prostate out surgically is called a radical prostatectomy, and that's something that I do quite often in my practice. It's something that I did extra training for after my residency in order to perfect this, and I usually perform it using the Da Vinci surgical robot. It's a minimally invasive way to remove the prostate gland and seminal vesicles and reconstruct your urinary system. If you have any more questions, please feel free to contact my office at any time, and I'd love to chat with you further and talk about your individual needs. Thank you very much.